from a program wise, recovery is often the basis of what success is in treatment, or abstinence for a long time has been the measure of success. So what then would be successful treatment? If not abstinence,
sure.
Then what?
So let's just say this. So, and again, it's about like the evolution of our path through life, right? So at 120 days after I've just started a process where I embraced and was willing to kind of do some work, is abstinence a great outcome? Sure it is. But let's talk about 3 years, right? 3 years in, and we have two guys, right? One, man, he would eat a brick before he ever took a substance again. However, in his NA meetings, as soon as a young female walks into the room, his radar goes up and he goes after her. So is his recovery better? Don't even want to have that conversation, but is it better than the guy who's 3 years in the program, doesn't go to meetings anymore, likes to smoke weed occasionally, has a beer maybe on a Sunday, right? Gets up, fulfills his responsibilities, is very kind, is very supportive, never goes after in a predatory way any of the females in the room. Tell me, like, whose recovery do I want to emulate in any way?
Yeah. Well, and then you think about, again, how do you define this idea? It has to be individually defined. So if you're in a 12-step room, it's going to be defined one very specific way, which is going to be related to the number of days in a row without the use of a mind-altering chemical, right? So,
yeah.
And then that's going to be viewed as, and look, I hate to say there's not wisdom in adding days in between use, because there ultimately is, right? I mean, if somebody has not used a substance for 20 years, they probably have a bit more understanding about life and in this idea of recovery in a certain way versus somebody who has 20 days off of a substance. However, a lot of times, to Ian's point, over the years, I have watched, I mean, I have not physically watched, but have known people who have hung themselves after 25 years of abstinence because of unaddressed issues or behaviors that continue to show up in their lives, which are creating such internal pain that does it make sense that that person died sober? Well, you'd hope that they wouldn't have done that in the first place. So would it have been better to actually use a substance to alleviate some of the pain? Again, it's like a conversation to not get into. However, it has to be personally defined. Like there's no way around that as soon as we start to define what success looks like for you, then our orientation is to our definition of what success is. So even if what we do is bring together 10 of the greatest professionals in the history of behavioral health, and we say, let's define what success is, the next person that walks in the door is going to have a different definition of that.
True.
And so, look, if where somebody resonates is within a community, a 12-step community, and that definition feels good to them, then like that's a beautiful thing, and that should be supported. However, the next person's definition of success may be that I'm no longer houseless, I have food, and I have my kids back. So who in the world are we to say that that's not success? And I think that's the question that we have to continue to ask ourselves as providers is, how in the world can we define success for somebody else's life, right? So if somebody, again, comes in and is on heroin and on the streets, but leaves and is using cannabis but is in school, working, and providing for themselves and their family, how the hell can I sit and say, that's not success, right? So I think that the more that we can continue to help people think for themselves, and within the provider landscape and colleagues and in collaboration, is to say, again, the moment we tell somebody what to do, which is, well, your North Star in treatment needs to be that, right? It's no longer trauma-informed, person-centered care that's focused in agency as a foundation. We're saying, as long as you abide by our definition of recovery, then you're a success, and if you don't, you're not a success. And I think that's just a really fucking dangerous game to play, now, especially in our context, talking about populations that need like Medicaid accessible care,
Yeah.
the definitions of success are very different, and they have to shift towards things like social determinants of health, which is ensuring people are not going back to the behaviors that led them to the care in the first place due to lack of medical care and housing and food and legal issues and dental care and all of these other things, right? So it's also, we have to be able to look at each individual differently. That, you know, the Manhattan investment banker using cocaine is very different than the houseless, rootless individual living in a rural community in Colorado. Very different, even if they're using the exact same drug, and the outcome is still both of them in treatment, right? We have to approach differently because of their internal and external resources are just very different.
And so you asked a question very at the beginning of this, like how do we define it? And you've said in full agreement, which is we help the clients themselves define it. From a clinical perspective, we treatment plan it, right? We put plans and objectives into a document that should be, again, for them like a roadmap to get well.
Right.
So here's what I would hear all the time. Somebody's just come out of detox and they've done maybe 15 days of residential, right? They're completely abstinent, and they come into our PHP IOP program and we say, what's your goal? And they say things like, not use, right? Not use. And again, certainly I'll speak for myself. Early on in my career, I was like, great, excellent, on the treatment plan.
Wonderful.
Now what I say to them is, you're not using. What else do you want to do? Because if that's what you want, that's your goal, you've achieved it. I don't, what else do you want?
What's the purpose?
And if they say to me,
Yeah.
well, I think like maybe it's the things that get in the way or that trigger me to want to use. And I would say, well, do you want to explore that? We can explore that with you. And if they say no, then I say, well, okay, then you have agency.
Right.
You can choose what you want to do. I spent some time last year working with some guys who really just didn't want to talk about that. They didn't want to talk about like roots and causes and conditions. And these were fellas that they were military and they clearly had grown up in kind of quite difficult families, and their experiences in the Naval Academy, again, there was issues in the Naval Academy, which I know a therapist would have said, like, we need to talk about that. And these guys didn't want to do it. And the one really was just like, no, this is a task. I just need the tasks in front of me. Just what are the tasks to stay away from this stuff? And we would explore, and he would say things like, well, I love, non-alcoholic beer. Like I drink it all the time. I go out all the time. Now, I've been in plenty of AA meetings where people would say to you, like, that's relapse. That's relapse waiting to happen.
Mm-hmm. Right.
Yeah.
Well, and yeah.
So again, so I just want to say this though. If I'm congruent and I'm authentic in that belief, then I also have to get away from one of my other notions, which is that you're 15 years sober, but you're 60 pounds overweight and you're diabetic and you end up in the hospital at least once every 90 days because you don't manage your blood sugar. That's not good recovery. I have to get away from saying that as well.
Sure.
That's their choice. Yeah.
Well, and it's also an opportunity for if that person ends up somewhere in our purview, those are also things that we can ask questions about. Mm-hmm. It does sound like you end up in the hospital from diabetic shock every 12 months. Is that something that
you'd like to address? Would you like to change that?
Yes or no? Yeah. Right? And